Thank you, Stuart. I'm here to update, as Stuart just said, in terms of digital and EPR. But before I do, I think it's important to acknowledge some of the infrastructure issues we've had over the last couple of weeks. So a couple of weeks ago, we had a data center outage, which was caused by a total network outages. And in the last week, we also had Wi-Fi issues as well, causing Wi-Fi to drop out regularly. All the teams responded really well and worked really hard to come together and get the systems stood back up again. I should acknowledge that the disturbances caused to operational and work on a daily basis. My teams were out on in the May building with Trust at other locations, supporting everybody and making sure that we had good business continuity, and also in the recovery. I was in the ICC and working to help put things right. In terms of, because people will recognise that there's two events in a couple of weeks. In terms of root cause, we believe the root causes are completely separate. So there's some comfort in the fact that the causes of these incidents are separate, but nonetheless, our resilience is not where it needs to be when we do have an issue, and it should take a matter of minutes to recover our systems and not 3 to 4 hours, which it has done. So moving forward, we are using the EPR funding provided and the opportunity provided by the EPR to make sure we get the basics right in terms of our IT infrastructure. So later this year, we begin work on replacing the total network replacement. That's all of our local area network. That's the fixed network. So when we plug a PC into the wall, and we're also replacing our Wi-Fi network in totality. As well as replacing it, we're also looking to make sure that that Wi-Fi network is designed for modern work needs and mobile needs when working around the main site and other locations. So this investment, 4 million to put it in contrast, is at least 3 times larger than any other network investment we've ever made, and that's coming this year. Aligned to that, we're also investing in our data center architecture, and we'll be refreshing and renewing our data center, and we're just undertaking the planning to invest 1 to 2 million in our data center to improve resilience and failover. So we were working this year to get ourselves back into a situation we have resilience and getting the basics right in terms of reliable infrastructure. That will place us in a really solid footing in terms of the electronic patient record, the EPR that's coming along, and the EPR is a really key part of our plans in terms of making sure that we have a more efficient hospital, a safer hospital, a hospital where we can ensure we're getting basics right in terms of making it easier for clinicians, not using multiple systems, but also having that information available, not on a paper note, and the information available where we can share that with partners within the system, within Plymouth and in the wider system, to have that continuous care pathway and to review how we deliver care. So in terms of the progress of the EPR, we're at the outline business case stage, OBC stage. So that's currently in with the regional team. We're expecting that to come out mid to late July, and as soon as that comes out, we are ready to press the button on going out to procurement and running a tender over the summer. The team have worked really hard to get all that documentation ready, and we're ready to press the button. We've been working with multiple stakeholders across the organisation, and Mac Armstrong, our CCIO, Chief Clinical Information Officer, has been working with his team to make sure that we've got representation from stakeholders all around the organisation to assess that procurement and make sure we end up with the right EPR solution. Once we get to preferred supplier, we'll be looking to push forward to FBC later this year and then looking to implementation in 2024. That's not it though. In terms of getting ahead, we've been looking at best practice from around the country and looking at what work we can do now to really get ahead of steam and get on the front foot and maximise this opportunity. So we are setting up work streams in terms of looking at our data strategy and how we manage data moving forward, understanding our current state and our pathways and what works for us, what doesn't work for us, doing gap analysis around that. So when we start working with the EPR supplier, we really know what we want in terms of our future state, and to align with all the other initiatives and the challenges and improvements that Joe set out and the initiatives that Stuart set out to make sure we bring the things together and maximise the opportunity in terms of having a more efficient and safer hospital. Mac and team are reaching out in terms of resources around that, and the programme is starting to mature. So we're looking at appointing the leadership roles. So I'm pleased to say that Mark Hamilton is taking on the SRO role, and we're spending significant focus on delivering and driving and leading the EPR project. And we're just putting in place the EPR leadership team as well as the resources around to start making that happen. So really good progress. We expect things to really heat up in terms of actually doing over the course of the rest of this year. And I think one final plea really in terms of the next slide, please. one final plea really in terms of engaging with us is that we'd really like you to come and talk to us. So we've got road shows out there ongoing at this moment in time. So we've been to Mount Gold and more of them are being planned. We're available in the library every Tuesday for drop-ins. We've got a really good digital care website, and we want to hear from you if you love digital and you're really enthusiastic about it. If you're a technophobe and you don't want to be involved in digital and actually the thought of an EPR makes you think, oh my days, just please come and talk to us, because you're just as valuable in terms of your insight and knowledge as the people that are really enthusiastic, because we need to design a system that works for everybody. So yeah, so the QR code is on the screen, so please come and engage with us, and we'll be delighted to hear from you. And I will hand back to Anne.